Ministers, this government's mismanagement of the health budget is no secret, but mismanagement on such a scale to force the HSE CEO to escalate the embargo on recruitment, withdraw job offers and scrap more than 7,000 essential frontline posts is beyond belief. This is beyond disastrous when the HSE is already facing unprecedented staff shortages in all sectors, affecting its ability level of services required. The health budget should at the very least maintain existing level of services and provide for any new measures. It sounds okay, but what if the existing levels of service being maintained are bed shortages in hospital, chronic staffing shortages, existing frontline doctors and nurses run ragged, people lying on trolleys in overcrowded emergency departments, and I speak from this. Recently I was in James's, and the staff in St James's are excellent, but you'd want to go to the A&E and see what it's like. It's hemorrhaging staff because they simply can't work there. It's that bad at this point, and I have spoken to them at length around this. Children waiting for years for life-changing surgery, hundreds and thousands on long waiting lists for urgent treatments, mental health services in complete disarray, no staff to deliver home care packages for our elderly, no jobs for our graduate nurses and doctors, no frontline porters or cleaners. With your government's budget, ministers, the HSE is not even running to stand still. Your government's decisions have sent them running backwards. Service levels are not being maintained or even reached. They are being decimated. In my own constituency of Kildare South, there are existing levels already fall far below what is desperately needed. Not enough public health service nurses to reach vulnerable rural patients. Frail and sick older people who desperately need home care packages won't be delivered because there's no home care workers. 100 posts now not being delivered in Naas Hospital because of the embargo. Fine Gael and Fianna Fáil have had 13 years between you to fix this health service, and still we are facing into this catastrophe. Gonair Shiv Golair. This government's continued failures has repeatedly put people's lives at risk. Enough is enough. You need to lift the embargo and properly fund the health service. And Minister, the level of service at the minute is so bad, people are actually going to die. We need to stand up here and say that. And I'm going to finish with this, Look, I recently asked the PQ around cancer diagnosis and cancer treatment in patients, and I was told it had improved. It was down to 57 weeks now. That's down 14 weeks on last year. Are we having a laugh here? Thank you.